$500 million in contracts using the mRNA vaccine platform that was critical to Operation Warp Speed. Again, an accomplishment that I think President Trump should get a Nobel Prize for. You canceled $500 million in contracts. Now, I grew up in a middle-class family, so $500 million seems to cancel, it seems to be, which is to create a platform by which to create vaccines. So it just seems inconsistent that you would agree with me the president deserves a tremendous amount of credit for this.
Is this a question, Senator Cassidy, or is this a speech that you don't want me to answer? Because I want to answer that question.
Please.
It's something nobody had ever done. I don't think any president, but President Trump can do it. It got the vaccine to market that was perfectly met virus at that time when it was badly needed because there was low natural immunity and there were people getting very badly injured by COVID. But it was also running therapeutics like hydroxychloroquine and ivermectin and protocols for treatments. And there were no mandates.
Okay, I have another question, so please.
That's when I began litigating against President Biden's mandates. Now,
so let me go on because
in terms of the canceling those contracts,
I have limited time, Mr. Secretary. I'm sorry. You called for, and rightly so, that we should restrict participation in agencies for those with conflict of interest. I would like to submit for the record a evaluation of the conflict of interest of those who are on the ACIP and the Vaccines and Related Biologic Products Advisory Board. It was not 97% as alleged, rather it was 6.9%, and it was 1.2%, I think, for the other panel.
Without objection.
Now, I am concerned, though, because many of those whom you have nominated for the ACIP board.
Excuse me,
can I have my time back?
Yes.
What I am concerned about is that many of those whom you've nominated for ACIP have received revenue as serving as expert witnesses for plaintiffs' attorneys suing vaccine makers. Now, one of my colleagues in another setting alleged that you seem more interested in settlements than science. If we put people who are paid witnesses for people suing vaccines, that actually seems like a conflict of interest. Real quickly, do you agree with that?
No, I don't. It may be a bias, and that bias, if disclosed, is okay. It's not a financial bias. It's not a financial conflict. It's not a financial.
Let me finish up. You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. And as I conclude, I would like to say this. Because of the conflicting recommendations made about COVID. This is from Eric Erickson, good conservative out of Atlanta, Georgia. Occasionally gives me help. My wife has stage 4 lung cancer. She is one of the people the COVID vaccine actually helps. Thanks to the current mess at HHS, CVS is unable to get her vaccine. Secondly, an email from a physician friend of mine. Hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. We are having our attorney try and render an opinion, but there's no firm guidance and concern about liability if vaccines are given to a patient requested but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Thank you, Mr. Chairman. Following up on that same line as Senator Cassidy, because that's exactly, I represent one of the most science-based states in the country. That is percentage of scientists per capita. And at your confirmation hearing, we asked about this, whether you would follow science. You've made a statement here today in your testimony that you would follow science, and yet you're not following science, and that's what Senator Cassidy's question was. It's a simple yes or no answer. Do you think the president deserves to get a prize for warp speed in the mRNA technology that saved so many lives? And you won't answer that question.
I answered it.
No, you're saying that there are problems with what was interpreted. You could say yes. You could say
I said the president also deserves a Nobel Prize, but our mRNA vaccines that we're working on, the ones that we canceled, which are for upper respiratory infections alone,
You
are those.
You canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the
I'm happy to have a detailed discussion with you about it. You're so wrong on the facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. The history on vaccines is very clear. This is the 20th century. That's how many people had vaccines and had illnesses. This is the 21st century. This is the decrease, 99% down to 100%. This is what was delivered with vaccines, and you don't want to support that. You don't want to support that evidence. So yes, the governors of the West, Washington, Oregon, and California, will take up the efficacy of science. Yes, the University of Washington will deliver the science that America will depend on, because you don't want to depend on it. And his own Surgeon General of the Trump administration said over 2 million lives were saved because of the mRNA technology, and you don't want to continue that. You don't want to continue that technology. So what country is going to now take up that technology lead? What country is going to do that? Leaving us more vulnerable to some other country, keeping the advantage on having the best technology. So I'm telling you, I represent a state that's about technology. I have two other quick questions for you.
These questions or statements, because I can answer that question if it's actually a question.
Do you believe in having the ACA and the support for the ACA that is about to expire? Do you believe in doing something about that?
In terms of the advance of the enhanced premium tax credits,
Yes.
that question was the Democrats had two chances to make them permanent, and they didn't. And they didn't
We're
for
the
a reason.
ones who delivered it. So I'm just
They
asking
didn't
you
for a
to know
reason.
if you want to do something about this. Yes.
I want to fix the system, and that's what we're doing, fixing systematically to make premiums lower. That's what President Trump
Do you
wants to do.
do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol.
The women who were talking about Epstein. Do you think they were a hoax yesterday?
Do I think they were
Do you think they were perpetrating a hoax yesterday?
perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first I'm hearing about it.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public. That's the first you're hearing about it. What I'm saying is you're perpetrating hoaxes. You, as the Secretary of Health, so you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease, but you're not putting solutions on the table to cover more Americans, and you're taking away the science and technology that has made us the leader that has saved, according to the first Trump administration Surgeon General, millions of lives, and you don't want to keep that going. So no, I don't support your continued efforts as Secretary, and I definitely think that our colleagues need to rally around science. If you want the Northwest to just continue to lead on all innovation and all healthy people, okay, we'll do that. But it's a sad statement for the rest of America and America's leadership on technology. Thank you, Mr. Chairman.
Thank you, Senator.
I definitely think.
Mr. Secretary, I agree with a lot of my colleagues saying I actually I do support you. I've not taken on chronic illnesses for people. I've got 2 kids, as we discussed when we met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve the problem.
Of course they won't.
I would say that seems where your emphasis is. I want to go back to just again some basic facts. Do you accept the fact that 1 million Americans died from COVID?
Lives were saved.
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there was also about the incentives, and these are
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You've had this job for 8 months and you don't know the data about whether the vaccine
Oh, and my problem is that they didn't have the data. The data by the Biden administration absolutely dismal.
So who was politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Campbell just said. From Surgeon General.
They fired Dr. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Cowles.
The Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know that the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services. How can you be that ignorant? Like, you know, I remember when we went to the hearing with you, I asked you about community health centers. You didn't know what one was. I've been visiting you. I'm glad you got to one. I think in April. I tell you what, I hear of community health centers, they are terrifying. With all due respect to my good friend, the chairman, the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then, how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is absurd. There's not a single, so my Republican colleague, there's not a single study that does not, I can tell you, I was in Franklin, Virginia, a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing healthcare policy, not being the doctor in residence for all of America. I hope I can just say, I'm still going to trust my doctor rather than your health advice. And obviously, Tom Cotton's going to, who knows who he's going to trust. But let me go back to policy because let's maybe lower the temperature a little bit. I got a bipartisan bill that would be a systemic fix, not a vote buying mechanism when Medicaid's getting cut than what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Will you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%. So there is actually ability to get rural providers.
President Trump supports that, and we support that.
So you would work with us to get that passed.
Yes.
That will increase costs for Medicare. So you were committed to that. I appreciate that. What about Sarah Wyden and I've got a bill because across America,
What about what?
hospitals are shutting down on their OBGYN services. Try to have a baby. I don't know about all my other French states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OBGYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue of saving lives. Fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come to a major community health center in Virginia and hear what is on people's mind. They want to get healthier? Absolutely. Count me in. But they also don't want their basic health care removed. Thank you, Mr. Chairman.
Senator Lakeman. Mr. Chairman, thank you. Secretary, good to see you again. As I traveled around Oklahoma during August, it was great to be able to be home. I had several folks that contacted me that we had some great needs to some rural hospitals as well. They're looking forward to the $50 billion for the One Big Beautiful bill that is targeting towards rural hospitals, starting at $10 billion next year. I know you're quickly getting all the instructions out on that. We know that's in process. It was good to be able to visit with them and be able to talk about that. They're very pleased. Thanks for the work you're doing on that. I also met with some of our groups that do incredible medical research on this. I I know the NIH grants were held for a while and being studied. Those have been released, and grateful to be able to see that because there's some amazing medical research is happening, including some longitudinal studies. They need those dollars released, so I appreciate you all getting those released out there. I did hear from a lot of our folks, I want to talk about one of these issues, from a lot of our hospitals. They immediately raised the issue of Medicare Advantage plans and how they're withholding payments, they're delaying payments back to hospitals, and a problem that's been for rural hospitals. I know you all are working on that as well. We want to work with you on that. But you and I have spoken on the second issue on that, is the pharmacy benefit managers. During the confirmation process, it was interesting when you and I met in my office, you said every single senator brought up PBMs to you, and you made the statement during the confirmation process, this is an area that President Trump wants to take on, is the pharmacy benefit managers. This is unfinished business in this committee, but I wanted to just know, what is HHS doing at this point on the PBM issue in particular to make sure we're not driving out rural pharmacies, and what we can do to be able to make sure that's fair?
I mean, it's a priority for the president. He talks to me about it, I would say, at least once a week, sometimes at 11 o'clock at night. We've met with the PBMs, and we are in talks with them. We're also in MFN talks with the pharmaceutical companies, who are also very interested in reducing the cut and getting transparency among the PBMs. And the PBMs have committed to us to transparency, to some protocol that will guarantee transparency. And then the part of the MFN negotiations would include direct-to-consumer marketing, which would eliminate the middleman. So I think we're doing a lot of PBMs.
Okay, that'd be very helpful to be able to see. It'd be very helpful for consumers across the country on this. You and I spoke as well, and you've made public statements on this, and the FDA commissioner made public statements on the issue of reviewing the safety issues of mifepristone. Your comments early on were, every drug needs to be treated the same, needs to look at the same, and not have political biases, and how things are actually examined. There were a lot of changes on the allocation of mifepristone for elective abortions under the Biden administration. It's now open to anyone without a prescription on it. You don't have to go through a doctor on it. There's all kinds of issues that are happening now on it. So the question was, you said that there would be a review on that just to be able to look at it, make sure we're following all safety protocols. Do you know a timing on that review?
I can't give you the exact timing. I talked to Marty McCary about it yesterday, and he said it is progressing at pace. We're getting data in all the time, new data that we're reviewing. And we know that during the Biden administration, they actually twisted the data to bury one of the safety signals with a very high safety signal, around 11%. So we're going to make sure that that doesn't happen anymore. We're producing honest science and gold standard science on that. I'll keep you abreast of where we are.
Thank you. Just go where the science leads on that. During the Biden administration, the Title 10 regulation that requires Title 10 family planning programs recipients to physically and financially separate from abortion activities, their Title 10 activities, and eliminate them promoting or providing abortion with those funds. That was flipped from the original Trump rule that was done on the first presidency. During your confirmation, you had committed to go back and look at that again and to be able to see. My question is, do you know the timeline for agency action for when that rule on Title 10 and the separation payments rule will be either reviewed or will actually be reinstated to the original Trump rule under his first presidency?
I don't know if they're I just don't know the answer to your question when they're actually reviewing the rule right now. I can tell you that the NGOs that have that issue, that refuse to separate their payments streams and separate their operations, are not getting funded.
Okay, well, that was an issue under the law when it first came out, to be able to keep those things separate by it. So I look forward to that. Thank you. Sure.
Thank you. Senator Hassan.
Oh, thank you, Mr. Chairman, and good morning, Secretary Kennedy. Just before I ask a question, I did want to note in response to the Secretary's statement that the Trump administration wants to lower the cost of health insurance, that across the country right now, the median increase for commercial insurers that we're seeing this fall is 18%, just as families are struggling to make ends meet. Now, I want to follow up on a line of questioning that Senator Cassidy began. Mr. Secretary, President Trump said that the COVID-19 vaccine produced by Operation Warp Speed was, and these are the president's words, a monumental national achievement. Although I have strongly opposed many of President Trump's actions, I agree with him that Operation Warp Speed in 2020 was a monumental achievement. Unfortunately, you are undermining one of the president's biggest achievements, which, as the president said, saved millions of American lives. You even went as far as to call President Trump weak for this life-saving accomplishment. Last year, you tweeted that President Trump has a weakness for swamp creatures, and that Operation Warp Speed was among, here's your quote again, the most devastating impact of President Trump's weakness. So, Mr. Secretary, was Operation Warp Speed a monumental national achievement, as President Trump said?
For the reason that I already said, and I assume you won't let me repeat, but I'm happy to if you don't mind. Yes, it was.
Good. Assuming it is a monumental achievement, you said it was, is it true that, as President Trump has said, he saved millions of American lives with the COVID-19 vaccine? Because you just expressed great confusion about that to Senator Warner.
The only confusion I expressed is exactly how many lives were saved. I don't think anybody knows that because of the data chaos.
So multiple studies have shown that the vaccine reduced infections and severe diseases and saved at least 3 million lives in the United States and millions more abroad in the first 2 years of the pandemic.
As well as those are modeling studies.
I will also note, just as you've been talking about data and concern about it, the process for COVID vaccine approval was public, it was live streamed, and it was out in the open. Manufacturers and experts have publicly submitted data analysis, and when the FDA has asked for more, they've submitted more. They've done that for years, and the evidence is clear and supports what President Trump has said. The vaccine works, and it has saved millions of lives. Your own process, on the other hand, has not been transparent. You repeatedly choose to ignore data because it doesn't match your preconceived notions and lies. So you have said that the vaccine did save lives. You've said it was a monumental achievement. And given that, if you agree with President Trump that the vaccine saved millions of lives, why have you acted behind closed doors to overrule scientists and limit the freedom of parents to choose the COVID vaccine for their children? Why have you done that?
For the COVID vaccine, that was removed by FDA because there was the industry.
No, it was behind closed doors, and scientists who said they wanted to brief you on the science, scientists who wanted to understand why the FDA, why you unilaterally changed the parameters for giving vaccines, making it possible now, to Senator Cassidy's colleagues' points, that they're going to have to go off-label
This is crazy.
to prescribe the vaccine for children. I'm not making things up. Do you know how the FDA approval process works and what an off-label? Do you know what an off-label prescription is?
I know exactly how it works. I know exactly how it works.
So why behind closed doors?
It's not behind closed doors. The industry makes the studies, and they could not provide a study that said that it was effective for healthy kids.
So when have you produced the data that you relied on, and that this FDA relied on to change those parameters? You did it behind closed doors, and now parents who decide that they do want their children down to I'm not.
You're just making stuff up.
You know, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy. So let's tell you this. So here's what's going to happen. To Senator Warner's point, to the parents who are concerned all around the country, to people who want to get the COVID vaccine this fall, even if they're under 65, because the boosters have worked, there's been much less serious disease. People do not have the same level of threat and risk from COVID that they used to because of these vaccines. People who want to exercise their freedom of choice are being denied that. Because you are citing data that you won't produce to the public, and you are objecting.
You're making things up to scare people, and it's a lie.
With respect, I do not think I'm the one making.
You are lying right now, Senator.
Senator Barrasso.
Thanks, Mr. Chairman. Mr. Secretary, thanks for being with us today. I believe one of President Trump's greatest achievements was his bold and successful actions on COVID. When faced with a global pandemic, he didn't back down. He was determined to find a cure, and through Operation Warp Speed, a vaccine was developed and distributed quickly, safely, effectively, and I believe it saved many, many lives. I think it's a model of American ingenuity and public-private partnership. But this wasn't the first time an American president acted boldly to address disease and vaccines. There's a great book that's out, a prize-winning book called The Fate of the Day by Rick Atkinson, and he talks about the courageous efforts by George Washington. During the Revolutionary War, George Washington reversed his opposition to the smallpox vaccine, and he ordered that all the soldiers be vaccinated. It was among the most consequential decisions Washington would ever make. By protecting his troops from smallpox, Washington preserved the Continental Army, which allowed our nation to continue to fight for our independence. And like President Trump, I believe President Washington acted decisively to protect Americans' lives at a time of great national peril. So over the last 50 years, vaccines are estimated to have saved 154 million lives worldwide. I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearing, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership of the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on. Recent polls said 89% of voters, 81% of Trump voters agree vaccine recommendations should come from trained physicians, scientists, public health experts. So, they believe, Senator Marshall, Senator Cassidy, and they believe me when it comes to vaccines. If we're going to make America healthy again, we can't allow public health to be undermined. So could you explain what steps you're going to be taking to ensure vaccine guidance is clear, evidence-based, and trustworthy?
Yeah, we're going to make it clear, evidence-based, and trustworthy for the first time in history. For most, right now, when I was a kid, I got 3 vaccines, I was fully compliant. Today's children have to get between 69 and 92 vaccines in order to be fully compliant between maternity and 18 years. Only one of those 19 vaccines, 92 doses, only one of those vaccines that have been tested against a placebo. And what we're doing now is any new vaccine that before it's approved and licensed, will have to demonstrate safety against a placebo. And we're going to go back and do observational studies on the existing vaccines to see if they're linked to any of these chronic disease epidemics so that people can understand the risk profile of those products and make good assessments for their own health.
So in 2 weeks, vaccine experts at the CDC are going to meet to discuss childhood vaccine recommendations. Parents and physicians depend upon this guidance to make decisions and to keep kids safe. And as I said, I support vaccines. I've been hearing from many of my medical colleagues, people I've known from medical school, residency, and when I practiced medicine in Wyoming, and there are real concerns that safe, proven vaccines like measles, like hepatitis B, and others could be in jeopardy. And that would put Americans at risk and reverse decades of progress. As we've seen over the last 4 years, the previous administration 4 years, when recommendations became politicized or were swayed by bias, that the public trust can be lost. So what safeguards are in place to ensure decisions are based solely on science and not politics? And how are you going to make sure doctors and parents can count on CDC guidance?
Senator, I would point this out. And right now, there's only 10% of children are complying with the CDC's recommendation on COVID boosters. Only 15% of healthcare workers. So Americans have lost faith in CDC, and we need to restore that faith. And we're going to do that by telling the truth and not through propaganda, by making them understand that everything that we say is true. That we're going to tell them what we know, we're going to tell them what we don't know, and we're going to tell them what we're researching and how we're doing it, and we're going to be transparent. It's the only way to restore trust in the agency, by making it trustworthy.
Finally, with chronic diseases like you, I'm committed to addressing our nation's growing rate of chronic diseases. I think if we're going to make America healthy again, we need to support rural primary care providers that play a role as a rural physician, knowing to make sure we can prevent and manage chronic diseases in their communities. And I ask for you to continue to work with us specifically with regard to rural health.
Thank you, Congressman.
Senator Baines.
Chairman, great, well, thank you. Senator Kennedy, welcome. It's good to see you here again. I want to begin my time by talking about the issue of federal deregulation of chemical abortion drugs. Since mifepristone was approved in 2000, 25 years ago, the FDA has steadily stripped away safeguards related to this drug, no longer requiring a doctor's prescription, no follow-up visits, no adverse event reporting, and now allowing it to be sent through the mail. Earlier this year, there was a new study that analyzed 865,000 real-world insurance claims, and it found that nearly 11% of women experienced a serious adverse event within 45 days of taking mifepristone. To put that in perspective, that is 22 times higher than the FDA's long-standing estimate of less than 0.5%. While these findings alone are shocking, my conversations with those in the medical profession, credible medical professionals, lead me to believe that even this study may indeed underrepresent the scale of the problem. For years, we've heard the misleading and frankly very harmful lie that's being sold to women that this drug is, and I quote, safe as Tylenol. These lies sadly have real-world consequences. Just last year, 2 women died as a result of taking chemical abortion pills because they were able to access them without appropriate medical oversight. And by the way, that's all allowed by the FDA. Mr. Secretary, I am grateful that you and FDA Commissioner McCary have already begun the process of reviewing this new data on the safety of mifepristone. You talked about this during your confirmation hearing. My question is, could you provide any updates on the status and the scope of that review, and whether the FDA intends to replicate studies like the one that I referenced?
I think those are, I don't know if they're going to do an insurance claim study. That's one way to do it. I don't know exactly whether they're doing epidemiological studies or observational studies. I don't know exactly what they're doing, but I know I talked to Marty McCary about it yesterday, and he said those studies are progressing and that they're ongoing. So I will keep your office informed at every stage.
Thank you. And I had a really constructive conversation with the FDA Commissioner as well, McCary, and here's a very smart, data-focused, sincere type of leader. And we had a really good conversation. I want to encourage those conversations with you, Mr. Secretary, and that there's a follow-up here to make sure that the data that we now have exposed will be studied by the FDA and the appropriate actions considered. Given the legitimate safety concerns surrounding mifepristone and your actions to roll back other COVID emergency measures, will you repeal the COVID-era telemedicine allowance, given that we're repealing these COVID-era regulations, emergency measures? Would you repeal the COVID-era telemedicine allowance for chemical abortion drugs and restore the requirement for an in-person doctor visit?
Senator, I need to get back to you on that. I don't know if the White House has yet taken a position on that, but we will get back to you this week about that.
Okay, all right. Thank you. I'm going to close with a quick Montana question. Earlier this week, the state of Montana submitted a Medicaid demonstration waiver application to CMS to strengthen the state's Medicaid expansion program. This waiver seeks to require community engagement and enhance caution for working-age, able-bodied adults enrolled in the program. I applaud our governor, Gianforte, and Director Brereton for the proactive leadership in this space. My question is, Mr. Secretary, could you commit the CMS will work quickly in its consideration of Montana's waiver application?
Absolutely. It sounds like the kind of waiver that we're looking for.
Okay, thank you, Mr. Secretary.
Thank you, Senator Johnson.
Thank you, Mr. Chairman. Secretary Kennedy, first of all, thank you for your willingness to serve and for putting up with this abuse. 5 minutes isn't even close to refute all of the falsehoods that have been confidently spewed during this hearing. We'll talk about real data here, okay? Well, first of all, thank you for breaking the logjam of information of HHS. My committee's got now over 8 million pages of information. Just in the first tranche, by the way, what we discovered is that the CDC, somebody in the federal health agencies, this interagency communication, hid the signal. They admitted there was a signal in myositis. They hid it. They didn't warn the public. They didn't warn doctors. So that's just one instance of corruption and lies told by the CDC. We've got a lot of others who will be rolling out. Okay, so we held our first hearing in front of the subcommittee investigation on that hiding of the signal myocarditis. We've heard a lot of studies. Okay, as I've looked into science, it's been thoroughly corrupted. Here's data. And I'd like to enter this sheet into the record. I've been publishing this chart for, since really early 2021. When I'm on, for example, talk radio shows and they talk about this, they get deplatformed, or they were, because all the censorship in the Biden administration. Here's the facts. The VAERS system that was touted in October of 2020 as this great safety surveillance system on COVID. A few months later, when they didn't like the results, they started denigrating their own system. But VAERS shows that there have been 38,742 deaths reported on VAERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved. I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high-integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high-quality study. I'm not going to steal the thunder. Baron Sear, who's going to be testifying on this. I think you're aware of the study. That shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, this study was conducted, and when they conducted, so, oh no matter what the results are, we're going to release this They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right? Is try to bring integrity and credibility back to science, which has been corrupted by the people who paid for it, by federal health agencies being captured by pharmaceutical industries, by big pharma, by big food. Just, I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands. In 2002, CDC did an internal study of Atlanta, Fulton County, Georgia children, and looked at children who got the MLR vaccine on time and compared those to kids who got them later. So in other words, kids who got them before 36 months and kids who got them afterward. The data from that study showed that Black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety science at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DeStefano, who's the head of the immunization safety department, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
Mandate. To be out of business, I just want to enter that in the record as well.
Without objection. The committee will take a 5-minute quick break here just to allow just a moment of reset here, and then we'll start right back up again in about 5 minutes. is returning back from recess on this. Senator Whitehouse is recognized for questions.
Thank you, Chairman. Mr. Secretary, I want to talk to you about Rhode Island. When you were last sitting there, here's what I said to you. I want to read it back to you because I want it to sink in. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers, a difference of 23 and 26% in our regional healthcare market. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act that CMS took on this issue years ago was to make it worse. I raised that with you then. I've raised it since with Dr. Oz. I've raised it with CMMI Director Sutton. I would like to get action from CMS on that. One partial avenue of relief for Rhode Island is the AHEAD program. Rhode Island is a willing voluntary participant in the AHEAD program. Coming behind Rhode Island is Connecticut. What remains to be seen is whether the payment rates agreed to for Rhode Island will suffer the same discriminatory discount with respect to the AHEAD rates for Connecticut as Connecticut comes through. I've been able to get no assurances from CMS that they care one whit about this payment differential, or that they see AHEAD as a means of resolving this injustice. Mr. Kennedy, our healthcare system is teetering as a result of this. This is not a casual matter, and I would really like to see you and Dr. Oz and Mr. Dutton put your attention onto this Rhode Island problem. There is no conceivable justification for paying a hospital in Fall River 23% more than Rhode Island Hospital. But Rhode Island Hospital provides more and better services, as recognized by the Secret Service, which will take an injured president from Martha's Vineyard to the Rhode Island Hospital Trauma Center, flying right over St. Anne's Hospital in Fall River, yet Fall River gets paid more. It makes no sense, and it has to be resolved. The other problem that I mentioned to you is that I'm now in my fourth round of CMMI directors. It's bloody Groundhog Day, trying to get something done about how end-of-life patients are treated. I'm offering Rhode Island as a willing example of how we can do it better. It is idiotic and cruel to force a family to put their dying loved one through 3 days and 2 nights of a hospital before they can put him in a nursing home. It is equally ridiculous to not allow palliative and curative care to happen together. Providing home care when someone is dying, even if they can still get out of the house or into the yard, is a basic thing to ask. And to have respite care be that somebody comes to the house instead of taking a dying family member to a hospital, that's not even respite. Every single one, Mr. Kennedy, of these waivers has been granted in the past by CMMS and other circumstances. All I want is for somebody to come and find out how we do this in Rhode Island. What is our patient base that will do this in? How we put the waivers together. To quote your CMS director, Mr. Oz, he said, as we discussed in your office, we must re-examine how end-of-life care is addressed in this country. I'm offering Rhode Island as an example of how to make it better. I hope you will concede that right now it is not good. So, everything you to respond to me. You guys know where to find me. I'm up in the Hart Building. Yeah. I've reached out. We've tried for meetings, and the progress in all 3 of those areas, fixing the payment gap, getting ahead balance regionally, and following through on our desire to do good things, improving end-of-life care with waivers you guys have already granted, has gotten me so far no place. And forgive my impatience, a lot of it predates you. I put a hold on Biden nominees because I was getting jerked around by your bureaucracy.
I'd like it to end and get some progress.
Yeah, you know, Senator, you raised this during my confirmation hearing, and I said to you then, and you were very civil. You raised something that makes a lot of sense to the extent that we have the power to fix it at CMS. I'd like to do it. We've had the same kind of complaints from Vermont, but I said to you at that time, call me and let's come talk about this. You have my cell phone. You can call me anytime. I've never heard from you in 7 months. Call me up. I'd love to meet with you. I'll get Oz in the meeting. And, you know, what you're saying, particularly about the end of life, it may be something we can do something about. I want to help. And, you know, let me know.
We'll try. Forgive my frustration. You've got 30,000 employees. They could have reached out to me. They know where I live.
Okay. Sir, Cortez Master.
Secretary Kennedy, thank you for being here. In May, you said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on big pharma to make America healthy again." Yet your record tells a different story. In July, Republicans handed Big Pharma a massive win. Their big, beautiful bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Keytruda has been on the market since 2014. It pulled in nearly $18 billion last year in the United States alone. It costs patients up to $175,000 a year, draining Medicare of billions and forcing families into crushing debt or to forego life-saving care. And yet you support the big, beautiful bill. So despite the hype with executive orders and Washington Republicans only drug pricing law days relief for Medicare patients relying on high-cost cancer drugs, meanwhile, Democrats finally have allowed Medicare to negotiate drug prices. I will say that Keytruda, along with Opdivo and Darzalex, the 3 top-selling cancer drugs, were widely expected to be selected for Part B negotiation in 2026 for 2028 implementation. They are now, because of the actions of this administration, exempt from negotiation for at least several additional years, if not permanently. So my question to you, Mr. Secretary, is how do you justify claiming to take on Big Pharma while supporting a bill that shields drugs like Keytruda and other cancer drugs from Medicare negotiation, costing seniors and taxpayers billions, and risking the lives of cancer patients who cannot afford their necessary medication?
Yeah, Senator, I appreciate the question. The Medicare drug negotiations in the IRA were very well intentioned, but they were poorly structured. And what we found is that there are actually the negotiations that have occurred actually have ended up raising the costs for Medicare. We are right now in negotiations.
CBO has not agreed to that. The CBO doesn't say that. So you're saying the CBO and independent agencies that validate the costs are wrong?
Well, that is CMS data.
Okay, so let's just focus on the cancer drugs. Why aren't we negotiating those and bringing those down for families? Why does the bill exempt those?
It's part of the MFN negotiations. I'm not sure that provision in the bill, of the one beautiful bill, but
You're not sure of the provision, the negotiation provision, how exempt for Keytruda? Your agency is responsible for that negotiation, and you don't know about it?
I know that we're negotiating in the MFN.
Let me ask you, Mr. Secretary, let me ask you another question. How much are Medicare Part D enrollees expected to pay for prescription drug coverage next year?
I think that is in debate right now.
Let me tell you.
Are you talking about the?
They are going to pay $15 more than last year. $50 a month.
$15 more.
How much are Medicare Part B premiums expected to increase next year?
I don't know. I've talked to Dr. Oz.
It's supposed to increase about 11.6% or $21.50 more each month. And again, last time you were before me, you couldn't answer the questions of the very agency and the authority that you have to address these issues. Next year, seniors and families are facing higher healthcare costs across the board. 23 million people on Medicare with a standalone Part D drug plan could see their premiums rise to $50 a month, up from $35, because the Trump administration is cutting the federal subsidy that has been keeping costs down. Part B premiums will jump 11.6% to $206 a month in 2026, one of the largest single-year increases in decades. And so for an administration that claims that it's lowering costs, my question to you is, what are you going to do to keep costs down for seniors?
I mean, I'm already doing what I did. I'm already keeping costs down.
What are you doing to keep costs down for seniors, knowing that these costs are going to be increasing?
I mean, the program integrity bill, that is the first action that I did when I got in. It's one of the earliest actions in history. Complex regulation by an HHS secretary. A congressional budget office has said that that's brought premiums down by 5%. That is the congressional budget office, which does not like to acknowledge anything that we do.
And does that impact seniors?
Excuse me?
Does that impact seniors? And I know my time is running out. Does that impact seniors? What you just talked about, you're lowering costs. I'm asking you specifically.
We're lowering costs.
Seniors. Does it impact seniors?
Does it impact?
Come on, let me just stop you. Time is running out, so I appreciate the chairman's indulgence here. My concern is you can't answer the questions. The very agency has oversight over these issues and controls the levers to lower costs for seniors. And you can't answer that simple question.
I didn't hear your question.
Okay, let's go.
We'll just proceed. And Senator Tillis has yielded his position, Senator Blackburn.
And thank you, Mr. Chairman, and Mr. Secretary, thank you for joining us today. I appreciate the comments you've made about the Rural Health Transformation Program. That is something many of us worked on, and we were pleased to push that out of this committee, and I know Dr. Oz is moving forward with implementing that. I appreciate your comments to Senator Warner on the area wage index. He and I have worked on fixing that, and we appreciate your attention. I am delighted to know that you're going to end the revolving door and the conflicts of interest. I have found it so unseemly that people who work with a pharmaceutical or with a big food company then go back over into CDC or NIH or FDA, and then they're signing off on regulation for their former employer and many times their future employer. So we appreciate that. Senator Langford went to you on the PBMs, and as you are aware, my PBM Act that Senator Wyden worked with me on, that made it out of this committee last cycle. And making certain that we keep these rural pharmacies open, making certain that PBMs do not profit above what is their standard service fee, and that they have to disclose all their pricing. That is going to be an imperative. So will you work with us to get that PBM legislation across the finish line and to the president's desk?
Yes, Senator, absolutely.
Thank you. Interoperability is something that you have announced, a new interoperability framework to better align data sharing principles. And this is important to digital health. And as you're aware, when we passed 21st Century Cures in 2018, the Software Act and that health IT definition is something that I worked tirelessly on to get implemented. So what I want to hear from you is, how does CMS plan to align this new framework with the existing federal framework, and how are we going to be able to move forward with one national policy on interoperability?
Well, I don't know if we, what we have right now is concrete commitments from the 60 top tech companies who we were able to convene to do data sharing, to do patient accessibility, and to do interoperability. But I can't tell you how that's going to mesh.
Then if you will have someone submit to me in writing what that pathway is, this is something that is essential if we're going to be able to benefit from that data. So having some specificity on the pathway will be helpful. I did want to talk with you. Last time you were here, I talked about the concerns on overprescribing prescription stimulant drugs for children. And there are ways that HHS can work collaboratively with state agencies on this and to actually promote more community-based intervention to combat overprescribing. And we all have seen the harmful side effects. And there's a lot of reporting out there on this and tremendous concern for grandmamas like me who see children and friends of our grandchildren who suffer with this. So I know your team is working on solutions. So you're going to have your Make Our Children Healthy Again strategy that you're going to release. But talk for a moment. We've got 30 seconds left. Talk for a moment on how you can better arm parents with information on the harmful side effects of overprescribing these stimulant drugs.
I mean, one of the problems, Senator, is that, you know, we now have 1 out of every 5 kids on these drugs and the antidepressants, even more. And we know very little about the long-term impacts because NIH and CDC have been asleep at the wheel. Right now, we are doing those studies. We're doing extensive studies so that we can warn parents and so that we can force the companies to put labels on their products. And, you know, we'll do whatever we can to show that, just to get data out to the public. That's really what our function is. And to show what the long-term impact of some of these drugs is. You know, are we actually preventing suicide or are we creating more suicide? And that's something that we don't know the answer to, which is, you know, how did these drugs become so common in our society without us even knowing the answer to those questions? That is malpractice at these agencies, and that is the malpractice that I am going to fix.
Thank you.
Thank you, Senator Warren.
Thank you, Mr. Chairman. So last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it.
Anyone. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like
and that
this.
is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free.
$dollars.
Most Americans will be able to get it from their pharmacy
The
for
question is, everyone who wants it, that was your promise.
I know I didn't. I never promised that I was going to recommend products with which there is no indication.
When you said,
And I know you've taken $855,000 from pharmaceutical companies, Senator.
did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator,
I'm not taking them away from anybody.
Secretary,
You want me to indicate a product for which there is no clinical data? Is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, you can't walk into a pharmacy the way that it could last month and get access.
It depends on the state. It depends on the states.
A year ago,
But they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to get.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines,
You are
Senator.
taking that away.
No, you can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still
Tell the
pay for them.
head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has
Well,
said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there
And
were
let me get this
witnesses.
straight. This is the same person that less than a month earlier you stood next to her and described her as unimpeachable. And you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar.
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders. I just want to pick up on Senator Warren's point. Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no. I'm writing a quote.
No, one second. And you're also repeating now that she is a liar, correct? Which you wrote in Wall Street Journal.
If she wrote that I fired her because she refused to sign on in advance for the ACID committee, no, that's not accurate.
No, you're calling her a liar, and I look forward to her coming before the Health Committee, and maybe this committee as well. All right, Mr. Secretary, I've got a bunch of questions. Appreciate brevity in answering it. So-called beautiful bill threw 15 million Americans off of healthcare, substantially raised premiums, and it's going to have a terrible impact on nursing homes, community health centers, rural hospitals all over America. Very briefly, is that really making America healthy again?
It's going to be the biggest infusion of federal dollars into rural health care in American history.
Yeah, you know why? Because you're cutting $150 billion for rural hospitals, you're putting $50 billion back. That's not an infusion. That's a loss of $100 billion. All right, next question. President Trump, who I don't usually agree with, called the COVID vaccines, quote, one of the greatest miracles in the history of modern day medicine that saved tens of millions of lives worldwide. Scientific community agrees with Trump. Lancet study found that it prevented almost 20 million deaths during their first year of use. Secretary Kennedy, are President Trump and the medical community right? Or do you still believe that the COVID vaccine was, quote, the deadliest vaccine ever made?
No, first of all, I didn't say that. I said that in terms of affairs reports a while ago. I said today, I think that President Trump should get the Nobel Prize.
So who's right? Is Trump in the medical community right, or are you right?
President Trump did an extraordinary piece of leadership.
Is he right or wrong? Did COVID save millions of lives?
As I said, he got Americans back to work. At that time, that particular vaccine, which perfectly matched the virus that was circulating then, and I have no idea how many lives it saved, but it saved quite a few.
What I find a little bit weird in this discussion, I'm hearing it over and over again this morning, Mr. Chairman, you've got the entire medical community on one side. You have the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association. All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are the organizations that are agreeing with you and casting aspersions on vaccines?
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz, Vinay Prasad.
So you got a few doctors who agree with you. I'm giving you
not a few doctors. What you're talking about is there's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical.
So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors. And the American Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the
everybody but you, Senator. But you know what? When you ran for president, we have a corrupt campaign finance system. Maybe you'll agree with me on that. Okay, you were already president, you got a billionaire behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so. And I think the issue
I don't even know what you're talking about.
Well, I think you do know what I'm talking about.
I don't know what you're talking about.
The issue is every time anyone
Are you saying the pharmaceutical industry was supporting my presidential campaign?
I'm not saying that. I'm saying that the pharmaceutical industry is a greedy institution which is charging us the highest prices in the world. They are pervasive. But to suggest that every institution, the AMA, the pediatrics people, is corrupt because they disagree with you is an insult.
It's not that people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya, with Marty McCary, with Dr. Oz.
You have given the names of a few people. I have given you the names of organizations representing hundreds of thousands of doctors and scientists. I yield, Mr. President.
Senator, tell us. Thank you, Mr. Chair. Secretary Kennedy, thank you for being here. You a couple of times you asked people if they were making a statement or a question. What I think I may do, just to give you a breather, is to make a statement with a lot of questions. And just for the record, I'd like you to have the opportunity to have your staff respond. I can't conclude from the discussion today where you are on warp speed. So I would like the definitive statement on exactly where you are. Was it good? Was it bad? Were the things that worked? Were the things that didn't work? I can't discern that from what you said here. I, for one, think that it was a signature accomplishment of President Trump and the mRNA platform.
I agree with that.
I look forward to you giving us a detailed statement on exactly where you are with warp speed. I'm not a doctor. I'm not a trial lawyer. I'm a boring management consultant. Another question that we'll submit in the record, I'll give you directionally where we're going. I don't see how you go over 4 weeks from a public health expert with unimpeachable scientific credentials, a longtime champion of MAHA values, caring and compassionate and brilliant microbiologist, and 4 weeks later, fire her because at least the public reports say because she refused to fire people that work for her. So as somebody who advised executives on hiring strategies, number one, I would suggest in the interview, you ask them if they're truthful rather than 4 weeks after we took the time of the U.S. Senate to confirm the person, just for the future nominee that we're going to have to consider. But I do also believe that some of your statements seem to contradict what you said in the prior hearing. You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that. And I'm sure that you will have some. You will do nothing that makes it difficult or discourages people from taking vaccines. There seem to be several reports that would seem to refute that, but I'd rather you just respond to it. I'm not going to come here and impose my belief over any of yours. That, again, seems to be contradictory to the firing of a CDC director, the canceling of mRNA research contracts, firing advisory board members, attempting to stall NIH funding, eliminating funding for the $500 million for further mRNA research, and just want an answer for it. On HR 1, I believe you know my concerns about HR 1. I've had several meetings with, and HR 1 is the big beautiful bill, OB3, whatever the brand is. But I've got an office with 60 staff, including half of them in state office. I've had 3 different estimates of the economic impact on the state of North Carolina. Can I get your comment? And I have been looking for somebody that's far more resourced than an office of 30 people up in here in D.C. to disprove my estimates with respect to the impact on North Carolina, period. And I've yet to have anybody. I would love to be embarrassed and be wrong, but I would like to get your commitment for people to tease through the numbers that I provided before the vote on HR 1 that says that if you normalize 3 independent estimates across a broad spectrum, $25 billion over 10 years. I don't need your response now. I want somebody to destroy my estimates, because to this point, the most resourced health agency in the world has only given me word salad responses, and I need that so that we can prepare for the response. $25 billion over 10 years is half of the rural relief fund over 5 years. And so we just need to have that fact as a matter of policy so that we can go in North Carolina and absorb it. And I know every state's different, and I'm assuming every one of my colleagues here have done the math for their states, not focused on that. But I want you to destroy my estimates if they're in fact wrong, and I want you to acknowledge them if in fact they're right. That will come into question as well. Mr. Kennedy, you've stated multiple times in response to other members' questions that scientists were lying. We'll go back to the record in cases where you've said that. I'd just like to see the scientific evidence to substantiate that. I'm going to stipulate that you were honest and you had research behind it. We'll go back and figure out what scientific studies you believe are founded on lies and not scientifically viable. And then finally, I just want to give you an opportunity. Apparently in the exchange with Senator Bennett, you said you agreed with Dr. Levy's statements, who said that the mRNA vaccine causes serious cause serious harm, including death, particularly in young people. They said you agreed with that comment. Did you agree with that comment or not?
I think that's true, yeah.
Okay, thank you. Thank you, Mr. Chair.
Thank you, Mr. Tillis. We now have Senator Smith. You're recognized.
Thank you, Mr. Chair. So, Mr. Kennedy, I have sat here for the last many minutes and listened carefully to your testimony. And I think actually Senator Tillis laid out so many of the ways that what you have said has contradicted yourself and others. I don't even know where to start. So I'm going to start here. Over the last 8 months, you have claimed to make America healthy again, but in actual fact, you have led the charge in the Trump administration to destroy what is best in our healthcare system. And your denials and your evasion and your lies here do not change that. You are the Secretary of the Health and Human Services. Yet you're trafficking in these fringe idea and discredited theories that are completely out of step with the scientific consensus, and you seem to be willing to say anything in the moment, even if it's untrue. So last time you were before Congress, Secretary Kennedy, you claimed, and I quote, "I have never been anti-vax. I have never told the public to avoid a vaccination." But in a podcast, you said the opposite. You said there's no vaccine that is safe and effective. So that sure sounds anti-vax to me, Secretary Kennedy. So let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so more denial, more back and forth. I mean, here's what I know.
Explain why, Senator, you just...
No, actually, I want you to listen to me.
Okay, go ahead.
I want you to listen to me, because I've been listening to you. You said that ACIP is an independent panel after you stopped it with your picks. You said that you want evidence-based science, but it seems that what you mean is evidence that supports your view, not the scientific consensus. I mean, you dared to sit there and call my colleague from New Hampshire a liar when she presented you with facts that don't support your view of the world. It's incredible. But let me move on. Just last week, in the days after the tragic shooting at Annunciation Catholic School in my home state of Minnesota, you went on Fox News blaming school shootings on antidepressants. You have no evidence of that because you have no evidence of a connection. And you want to talk about...
You're just saying something. You're just making stuff up.
You know, this is what you say, right? Secretary Kennedy, when someone presents you with information that does not fit...
I did not blame that shooting. I have no idea whether... I have no idea, and I never said that. You're making it up.
I am not...
Yeah, you are.
Secretary Kennedy,
dishonest right
if you want to talk about mental health and gun violence in this country... If you want to talk about mental health and gun violence in this country, we should be talking about that, because that's what the parents of Annunciation School
You don't want to talk. You want to harangue, and you want to politically, you want to have partisan politics. I want to actually solve these problems.
Mr. Secretary Kennedy, what the Trump administration is doing right now is making it harder for people in this country to get access to mental health care. So don't talk to me about solving the mental health care crisis when you are making it harder. You cut Medicaid, which is the #1 payer for mental health care services in this country. You decimated the agency of Health and Human Services that focuses on mental health and substance abuse. That's what states count on. They're cutting their services to schools as a result of that. Several years ago, in a bipartisan way, Congress came together and passed the Safer Communities Act, which made important investments in mental health care and did some important, though small things, to reduce access to guns. What do? You propose cutting that funding. This is what we're talking about in your leadership in the Department of Health and Human Services. If you want radical transparency, as you talk about, I mean, take a look at what you are doing. And, you know, I've heard a lot about MAHA today while we've been here. There's a lot of Americans, Secretary Kennedy, who trust you, who believe what you say, especially when you say you're standing up to corruption. And I think that they need to know you apparently have a lot of influence with President Trump. Did you ask him not to roll back these regulations that are stopping the big corporations from dumping heavy metals and endocrine disruptors into our soil and water? I mean, there's no evidence that you have been even opposing that. Did you do anything to stop the Trump administration from rolling back this handout to Big Pharma that makes it easier for the big drug companies to charge more for cancer drugs? No, you presided over that. I mean, it's stunning, really, what's happened over the last 18 months. It's stunning to me. And I just hope that in this moment, our colleagues, and there's hardly anybody left in this room, are going to think about what it is that you've done, what your legacy is going to be at the Health and Human Services Agency, and pay attention to the damage that is being done here.
Senator Marshall. All right, thank you, Chairman, and welcome, Mr. Secretary. One of your themes for the CDC is transparency. And I think when I hear you talk about transparency, I think part of that is sharing what you know, what the CDC knows with parents so that they can make decisions. Behind me, yeah, I know it's going to be hard to see from there. I can barely read it. This is the current CDC recommendations for vaccines for children. On day number 1, they get their first jab, a hepatitis vaccine. By the time they're 18 months, they've had 18 jabs. By the time they get to be able to vote, they have 76 jabs. Now, when we talk, when I listen, what I hear you say is that, look, vaccines are drugs. We need a measured response and a measured, when do we use this? It's interesting that the United States has put age 65 and older for COVID vaccine. UK has chosen 75 and France 80. Obviously, scientists disagree exactly when that should or shouldn't be. Hepatitis B vaccine, it makes no sense to me. I've only delivered 5,000 babies, but we do a hepatitis test on every mom. By the time she delivers that baby, I know her pretty well. And if she doesn't have any risk factors, if she's not an IV drug abuser, if she's in a stable monogamous relationship, nobody at home has hepatitis, I don't know, I don't see the benefit myself in that hepatitis vaccine. Everyone's eligible for it, everyone can get it, and my pediatricians always agree with me. And no, I'm not saying if you don't know the hepatitis status of that patient, they shouldn't get it. I'm not saying that if this person's had no prenatal care, that puts them at risk for hepatitis. Can you just speak a little bit, when you talk about transparency, and trying to empower and make vaccines available, these should be treated just like a medication.
Yeah, I mean, I say I'm not anti-vaccine. Saying I'm anti-vaccine is like saying I'm anti-medicine. Well, I'm pro-medicine, but I understand some medicines harm people. Some of them have risks. Some of them have benefits that outweigh those risks for certain populations, and the same is true with vaccines. And we don't understand the risk profile because vaccines are the only medical intervention, medical device, or pharmaceutical drug that are exempt from pre-licensing safety studies. And so there are 2 hepatitis vaccines, and one of them had a safety study that lasted for 4 days on 143 kids, for a product that's going to be given to 76 million kids. The risk profile prior to the introduction of the vaccine, the risk of a baby dying from hepatitis B was 1 in 7 million. That means you need to give 7 million hepatitis B vaccines to prevent 1 death if you're going to give 7 million.
So, Mr. Singh, I guess before the press labels me wrong, I'm not anti-vaccine either. I think MMR has been a great vaccine. The DPT has been a great vaccine. Polio has been a great vaccine. Smallpox. So they are great, but it's the measured approach that we're after, the transparency. You're trying to empower parents here. What I feel the difference is, sometimes my friends across the aisle feel like there's a one-size-fits-all, that they should be telling parents what to do. And what you and I are fighting for is we want to empower parents to make these decisions. I want to talk about morbidity and mortality COVID for just a second. It is so true that 2 things can be true, and I don't understand why just the rabbit hole some of my colleagues are going down. There's a big difference. When I was out there practicing, doing volunteer work, I was so confused myself on the numbers. People dying with COVID versus from COVID. And we still don't have that message. And I think that's what I hear you saying as well. How many people died from COVID versus with COVID is a different answer. The situation today is so different. When this monster virus was made in a laboratory in Wuhan, China, and none of us had ever seen this virus, and we had no immunity to it. But today, every American's had
COVID a dozen times probably, and we built up immunity. I think it's like both things are true. It was a miracle. Warp speed was a miracle. What President Trump and his team did, and it saved millions of lives most likely. But it's also true that it probably killed some people. Like most vaccines, there is a death rate. So both things are true. Anything else you want to clear up on morbidity, mortality of COVID and COVID vaccines?
Well, I think you just cleared it up. The COVID vaccine was critical. President Trump's leadership got it to us when our society was locked down and allowed us to open up. It was, as I said, perfectly matched to a virus that was new in the experience of humanity. And so it was a miracle. Right now, we're dealing with completely different circumstances where the virus has mutated, where it's much less dangerous, where there's a lot of natural immunity and herd immunity. And so the calculus is different and it's complicated. And, if you just want to turn everything into a soundbite, it makes it, you can't have a grown-up conversation. But there were more reports to VAERS, which is the only surveillance system that we have of injuries and deaths from that vaccine than all vaccines put together in history. So we have to acknowledge that there was a cause. We acknowledge that there was a benefit. We can't quantify either one because of the data chaos at CDC, and that's all I'm saying. And they think I'm being evasive because I won't make a kind of a statement that's almost religious in nature. Did it save 1 million lives? Well, there's no data to support that. Or maybe data, there's no study that there's modeling studies, there's faulty data. I'm not going to sign on to something if I can't do it to a scientific certainty. It doesn't mean that I'm, anti-vax. It just means I'm pro-science.
Thank you. I yield back.
Thank you, Senator Lujan.
Thank you, Mr. Chairman. Secretary Kennedy, Dr. Daskalakis, who recently resigned as director of the National Center for Immunization and Respiratory Diseases, his resignation letter stated he and his team were never allowed to brief you. I'm curious who you're listening to, since it's clear you're not listening to qualified experts like Dr. Daskalakis. Can you give the committee the name of the person?
I don't consider Dr. Daskalakis.
Mr. Secretary, the question that I have for you is, can you give the committee a name of who you're getting briefed by?
I'm getting briefed by all the time by CDC.
Just a name.
Dr. William Thompson's one name.
Thank you very much, sir.
Now, but I can get you a whole list of others on my schedule.
Mr. Secretary, that's not a hard question. You know a lot of answers.
I'm not being evasive.
Okay, then you answered it. Let's go on. Now, you said that you're soon going to release a study claiming to reveal the cause of autism, timed unsurprisingly with the upcoming ACIP meeting to justify taking vaccines from Americans. Now, as you know, autism affects millions of children. So I guess you have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting the study.
He's a contractor?
He's a contractor.
Do you know who works for you, Mr. Kennedy?
Yeah.
Do you know that Mr. Geyer is listed as a HHS on the employee directory as a senior data analyst, not a contractor?
He's a contractor. He's not an SGE.
So is your website wrong?
He's not an SGE. I don't know what.
I'm going to pull up the website for you.
He's a contractor.
If the website says he is a senior data analyst, will you at least admit to the
Well, I don't know if a contractor can be classified as a senior data analyst or not.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board. He sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot. It's incredible.
Senator, you're ridiculous.
So here's the question I have. You brought him in to do this study. I think there's no question about it.
I told you he's not doing a study.
Is he participating in the study?
No.
Is he doing any analysis in regards to this?
No. What he's doing is getting access to the vaccine safety data link, which is the biggest repository for vaccine information that your friend would not give us for 7 months.
Mr. Secretary, let me ask you this question, just because you know the answer. What is Mr. Dyer doing?
He is the only one, because Congress ordered CDC to open up the VSD to him in 2002. He's the only outsider who's ever seen it. So because CDC did not give us the
Mr. Secretary, is he participating in this thing?
No.
You just said he's the only dude that knows what's going on here.
Do you want me to explain it to you, Senator? Or do you
No,
just want to show it? You just want to show it, though?
I'll submit
You just want to show both for your ads, or do you want to hear a real answer to your question?
Mr. Secretary, you choose to know answers to questions with some colleagues.
I'm willing to give you the answer.
Secretary, someone should have asked you, maybe President Trump should have asked you, are you a trustworthy person? And we should have waited for an answer then. Let's move on.
I don't know what you're talking about. They're talking gibberish.
Mr. Secretary, let me speak slowly and clearly so that you can understand me through my New Mexico accent.
Give me a chance to
Does this help? Can you understand me?
Yes.
Appreciate that. Mr. Secretary, yes or no, did you hire Mr. Dyer to do this study?
No.
Mr. Chairman, well, let me ask, maybe we'll just get a good answer here. Mr. Secretary, will you commit to sharing the protocols used for the autism study with Congress and to the public?
They're public.
Will you commit to giving it to this committee by the end of the week?
No, not because that's not the way it works. You don't even know what you're talking about.
Mr. Secretary, will you commit to sharing the protocols for this study by the end of the month?
We already have
You said it's public.
We put out the notice of funding opportunities, and then the scientists from all over the world.
You're not understanding me, ladies.
No, you're not understanding how the world works.
Do you understand what the protocols are? Do you understand what they are?
The scientists who are doing this study submit the protocol.
Okay, so
That's not coming from us.
So will you commit to sharing those protocols with this committee?
Well, anybody can get a hold of the protocol. It's published with the study.
Mr. Chairman, what I'd like to ask is for your commitment here. I'll send a letter to the Secretary. I'll ask for support from the leadership of this committee to ask for those protocols. If those protocols are not given to this
Anybody can get the protocol.
Mr. Secretary, I'm not talking to you. Mr. Chairman,
if the protocols are public, we can work with you.
What I'm asking, Mr. Chairman, is that if those protocols are not given to this committee, I'm asking for your agreement that we follow through with a subpoena to get them.
No, I will not agree to subpoena anything. Let's see what happens.
Mr. Chairman, you'll help me get them if they're available publicly?
Yes.
I appreciate that, Mr. Chairman. Mr. Kennedy, with all the questions here today, people just want to know the truth.
I don't think so.
Mr. Secretary, you don't think so? Thank you.
I don't think so.
I hope everyone recording that got that, because they're explaining the Secretary's tenure here. Look, 2 young ladies in Las Cruces, New Mexico, at a town hall recently gave me this starfish pin. I was going to give it to you today, but after your questioning today, I don't think you deserve it, because what this represents is to remember that every one of us can make a difference, or to something as small as a starfish on a beach that maybe got washed up, you throw it back in the ocean. You might not save them all, but you can save one. I'm sorry that you're not worthy of this nice little pin, sir, as a nice reminder. I'm going to pray for you, Secretary Kennedy. I hope we do better. I want you to do better. But today was a failure for you, man. I yield back.
Senator Warnock.
Thank you, Brother Chair. Less than a month ago, we received the heartbreaking news that a gunman opened fire at the CDC campus in Atlanta, Georgia. This obviously is my neck of the woods. This is heart-wrenching for all Americans, but for those of us especially who live in that area. The County Police Officer, David Rose, was killed. The shots hit buildings on campus in at least 180 places, narrowly missing the CDC's daycare center. Law enforcement recovered nearly 500 shell casings. Clearly, he came to do a lot of damage. It's a miracle, and thanks to the quick action of Metro Atlanta and state law enforcement, more people were not killed. The Georgia Bureau of Investigation announced that prior to the attack, the gunman expressed discontent with the COVID vaccine and, quote, wanted to make the public aware of his distrust of the vaccines. Secretary Kennedy, I assume you are aware of these disturbing reports of the gunman's motives?
Yes.
And, I understand that some people may have concerns about new medical breakthroughs. Those people don't have the world's top medical experts working under them. You've been over HHS for 7 months now. Have you ever been briefed by CDC's career immunization officials to discuss your concerns?
By the way, every member of this panel has criticized President Trump.
Have you ever been briefed?
Complicit in the assassination attempt on President Trump?
Sir, I'm asking the questions. You are the witness. It's a simple yes or no question. Have you ever been briefed by CDC's career immunization officials to discuss their concerns?
Yes, I have.
What was the answer?
Yes.
You have been briefed by CDC officials. The career immunization officials express your
the senior vaccine safety scientist.
Have you ever been to the CDC as secretary before the shooting on August 8th?
Have I ever been there as secretary?
Have you been there as secretary before the shooting? Okay. Let's return to the shooting and the aftermath. Secretary Kennedy, I'm about to ask you a series of yes or no questions about the events of the past month. And I would appreciate just a yes or no response. You called Dr. Monarez to your office on August 25th for a meeting. Is that correct? Yes or no?
It could be. I just don't know the date. I'd have to check my calendar.
Was Jim O'Neill the man you just appointed as acting director of CDC in the room on whatever date you met with him, since you can't recall? Was he in the room when you met with Dr. Monarez? In that meeting, did you criticize Dr. Monarez for her statements to CDC following the shooting where she said, quote, misinformation can be dangerous?
I don't believe so. I have no record.
You don't believe you criticized her?
Oh, I criticized her.
Did you criticize her? Did you criticize her? Did you criticize her for her statements to CDC workers following the shooting?
Did I what?
Did you demand that she fire career scientists or public experts at the CDC?
Yes.
Did you demand that she accept the recommendations of your hand-picked vaccine advisory panel without further review by career CDC scientists?
No, I did not.
You didn't ask for her a commitment ahead of time that she would accept the recommendations from the advisory panel?
What I asked her about is she had made a statement that she was going to not sign on. And I wanted clarification about that.
Did you tell her to accept the advisory panel's recommendations?
I told her I didn't want her to have a rule that she's not going to sign on to it.
Did you say that the CDC was, quote, the most corrupt federal agency in the history of the world?
Not the history of the world, but definitely.
Did you say
HHS?
Did you say?
I did not say that, but I did say it's the most corrupt agency in HHS, and maybe the government.
So you call the CDC corrupt? Did you say that CDC staff are, quote, horrible people?
Horrible people.
Did you say that they're killing children and they don't care?
No.
Okay, I think that we all have a history of listening to you and these answers. But you're on the record for a number of these statements. Despite your lack of credentials and expertise, clearly you have an agenda. It is a threat to the public health of the American people. It's clear that you are carrying out your extremist beliefs, which is why you attempted to fire Dr. Monarez. Sir, I'm
the sickest people on earth.
I'm speaking.
How am I?
Secretary Kennedy, for the first time, we're seeing deaths from children from measles. We haven't seen that in 2 decades. We're seeing that under your watch. You are a hazard to the health of the American people.
Can I respond?
I claim that in my time.
We need to
You are a hazard to the health of the American people. I think that you ought to resign. And if you don't resign, the President of the United States, who put forward Operation Warp Speed, which worked, should fire you. Thank you so much.
Senator Welch.
Mr. Chairman, thank you. I want to sum up, and I want to make 3 points. First, we have a healthcare affordability crisis in this country. And second, Secretary Kennedy's policies is making that affordability crisis worse, not better. And third, Mr. Chairman, the United States Senate is not doing its job. Healthcare. Citizens of the United States, our employers, our taxpayers, our families pay the most and get the least. That has been persistent and chronic, and it's not being addressed, it's being aggravated. Let me be specific. In Vermont, a family of four that makes $82,000 in income with premium support on Obamacare now pays $6,970 for their healthcare premium. That is going to increase $23,000 to $30,000. That is unaffordable. It's shocking and it's cruel. The big beautiful bill that we're talking about, Vermonters are going to lose 45,000 families lose health care. That is going to be a hammer blow to our hospitals because those folks who lose health care don't get a guarantee they won't get sick, and they're going to show up at our community hospitals. Our community hospitals are going to treat them, and they aren't going to be compensated. And it's why Vermont community hospitals are on a financial thin ice, and that's true that about 338 hospitals around our country are in danger of closing. Second, Mr. Chairman, I believe the Secretary made assurances to this committee, and he has not kept the promises he made. Prices have not come down, they've gone up. He assured Senator Cassidy that he would not change the standards for vaccine review. Yet since his confirmation, all 17 members of the Vaccine Advisory Board have been fired by him. He has limited the use of COVID-19 vaccine. And he has inexplicably canceled $500 million in vaccine research and funding. So, I'm not surprised. Stephen Miller credited you with being the crown jewel of the cabinet. And my observation about the crown jewel of the cabinet and the policies of the folks who get rewarded are the ones who fire those in service that speak truth to power. Susan Menares, we've gone over that, fired because she refused to fire herself, staff without cause, and refused to rubber stamp changes to the vaccine schedule without data. The head of the Bureau of Labor Statistics was fired because she gave a report with honest numbers about the job report. CIA Russia expert who'd been there for 30 years, fired after the meeting with Putin. So, Mr. President, that is serious and worrisome. But I want to finally end by challenging us in the United States Senate to do our job. We have a constitutional responsibility to be a check and balance. And the fear of our founders was that there would be a concentration of power in one branch, and that would lead to catastrophic consequences for our country. And what has Congress done? On oversight, advice, and consent, we have confirmed a vaccine denier. On tariffs, we've given up our constitutional responsibility. On appropriations, we're bending the knee to an administration that is rescinding and decided what to spend and what not to spend, despite what our law in a bipartisan way was passed. We cannot cede power, and there are consequences. A crumbling healthcare system, a deficit exploding, and our allies losing faith in us. Mr. Secretary, in the past, you have accused some of my colleagues of being in the pocket of pharma shills. You did that with Senator Warren today. You've done it in the past with Senator Bennett and Senator Sanders. You are not a pharma shill. But I believe we have to fight pharma and bring down the prices. And Senator Cortez Masto spoke about the legislation that we now have that would reverse the $5 billion handout to big pharma in the one big beautiful bill. And when I leave today with Senator Wyden, we're going to go to the floor and seek unanimous consent to pass our legislation that would reverse that giveaway. And I ask you to put your policy in your body where your mouth is, and join us in supporting that bill to restore price negotiation power so those pharma prices can come down from being the highest in the world to something within range of reason. Mr. Chairman, I yield back.
Thank you very much. Senator Young. Welcome to the committee, Mr. Secretary. It's my intention not to raise my voice and to give you an opportunity to respond to an inquiry. I'm going to begin with long COVID. It shouldn't be a surprise to you. During each of our meetings, we've discussed my interest in making sure our government does its part to address this challenge, which afflicts, by most recent estimates, over 20 million Americans. They have been diagnosed. There are a number of others we know that go undiagnosed. Over 400 million people worldwide suffer from this at a cost of $1 trillion a year, which is roughly 1% of global GDP. This, we know, has had impacts on participation in the workforce, therefore our own GDP. So it's serious on a number of fronts. It's my hope we can come up with some therapeutics for this condition. One of the real barriers to that is seeing that we are able to launch more clinical trials. I want to get your update on how the clinical trials are going, what plans you might have in the works to increase the number of clinical trials as it pertains to long COVID.
Yeah, Senator Lee. There was a project funded, a long COVID project at NIH. There was a huge amount of money spent on it. It yielded nothing.
I agree with that.
Right. I think you know that we are doing now a different approach. We're launching a long COVID consortium. We're bringing together the best doctors in the country who have developed reputations for being able to treat long COVID. And one of them is a doctor that actually...
Dr. Bruce Patterson.
Bruce Patterson, and then Dr. Jordan Vaughn, also from Florida. There's a number of them who are doing spectacular things where patients are reporting extraordinary progress. We want to get them all involved all in one room. We want to identify the protocols that are working. This is something that did not happen during COVID. It was all ivory tower science, and the doctors who were on the ground were ignored. The same thing happened during the HIV crisis.
Yes.
And we're trying to do something different.
Which my time is limited. You mentioned ivory tower. And so that's a segue into a statistic that I've become familiar with over the years. It takes roughly 18 years for proven interventions, pharmacological or other types of medical interventions, to make their way out into the field. If we assume, I think a conservative estimate, 12 to 15 years until we have any really acceptable therapeutics for a long COVID, that's a full estimate. Plus the 18 years until it finds its way into clinical practice, people roughly my age will pass. Actuarially speaking, they will pass before there's any acceptable therapeutic. So we need to accelerate our current activities. Can you give me a couple of things you're going to do to ensure that we accelerate our development of therapeutics?
I mean, the best solutions, same kind of solutions that we should have been pursuing during COVID, which is off-the-shelf approved drugs for that are there already.
Yes.
So you don't.
It was recently reported that all the major pharma companies, I'm sorry if there's one good student exception, are serving as barriers to clinical trials.
It's
How can
bizarre.
it be purpose?
It is bizarre that that's happening.
Okay, you're the Secretary of HHS. Will you be cracking down on this
Yes.
cooperation?
Yes.
Thank you.
Yes.
Thank you so much. Will you also be exploring research partnerships with other countries, seeing as I've established this is a global challenge for you?
Yes.
Okay.
That's what we should have done during HIV. It's what we should have done during COVID.
Will you also be exploring whether ARPA-H, which has different research protocols than NIH, NIH is very good at what they do, but it takes them a really long time to prove things because of their rigorous process. ARPA is more practical, right? And so one could imagine ARPA-H tackling this challenge. Will you be encouraging?
Absolutely open to that, Senator.
Okay. Will you be working with me and other members of the committee on your aggressive strategy as it continues?
Yeah, and looking for good ideas everywhere.
Okay, the last thing I'd like to briefly touch on with the chairman's indulgence is just recognizing the president's leadership as it relates to the appropriate use of civil commitment to deal with homelessness challenges, mental health challenges, etc. He's taking a look at these practices. This could be a difficult conversation for so many of us, but I think it is worth considering whether government can play a more assertive role in helping people off the streets who have serious mental illness get off the streets, receive the sort of treatment they really need to be healthy. Can you provide some very brief thoughts on this topic, and maybe then I could follow up with a phone call
On the topic of
civil commitment? We can follow up, Mr.
Secretary. Happening in the state, so I want to hear your ideas on it. If there's something they can.
Yeah, I think the president said, we ought to take a look at it. If there's somebody in 20-degree below zero temperatures consistently in Washington, D.C., and are believed to perhaps have mental health challenges, might we consider how to offer them care in a controlled setting rather than allowing them to freeze to death? It might be humane as we consider application of laws.
Follow up on that with the And Mr. Secretary, you've been here just like a minute or so under 3 hours. We appreciate that. We're not quite done yet. Senator Wyden has asked for one more round, so I said he, as a ranking member, should have the right to have one more round of 5 minutes for himself. And so, Senator Wyden, why don't you go ahead?
Mr. Secretary, we'll keep this brief. I want to ask about mifepristone. I was the first member of Congress to hold a hearing on this drug, which now has served more than 7.5 million women. And of course, it is used for reproductive health and medication, abortion. It has been documented again and again as safe. And people say safer than Tylenol. And the reason that I'm asking the question is that I'm getting reports that you've said you're going to conduct a complete review of mifepristone safety. And what we're hearing is it's not based on new clinical trials or data from the scientific community, but on one reviewed paper that's not a peer-reviewed paper by a political organization and Project 2025 sponsor whose stated mission is to advance an anti-abortion agenda. So what I'd like to hear today is for you to say that you'll commit that your best scientists, without bias, will be permitted to conduct this entirely unnecessary safety review. I don't see any evidence for it. You've called for it. But what I'd like to do is make sure that it's done right, and I'm very troubled by what I've heard about it. Your thoughts?
You have my commitment.
Okay.
We need good science and good scientists.
Okay. We'll get back to you to talk about specifically how that's going to play out, but I appreciate that. Okay, one last point for you, Mr. Chairman. I'm going to ask unanimous consent to enter into the record declaration by these kids, some of them very young, who
in the middle of the night, we were told by whistleblowers are being whisked away and the like. And what I'd like to enter into the record are statements by these kids that we have learned about, and also a memo prepared by the Guatemalan government outlining the deportation effort into the record. We've been able to obtain that, and I think it's an important part of the debate. And with that, repeat my time of 5 minutes.
All right, without objection. Thank you very much, Senator Wyden. And we're now at the point where I'll just make a couple very brief personal closing remarks, and then I've decided, Mr. Secretary, I said at the outset of this hearing it was going to be some partisan battling going on. That is something that is very obvious to anybody who's paid any attention to what's happened in the last 3 hours. There were several times that you were cut off, or I had to cut you off because we needed to keep moving along. And I'm not suggesting that you need to or should, but if there's anything that you felt you didn't have a chance to say, if you could briefly say it now, or if you would like, you'll have the opportunity to submit written responses to questions, which I'm going to reference in a minute, and you could make any further statements that you would like to make at that point. But
I think I'll have mercy on everybody here and let us adjourn.
all right, wise choice. Let me just say now that senators will be allowed to submit questions to you for the record by next Thursday, September 11th by 5 p.m. And I just want to say, Mr. Secretary, during former Secretary Becerra's tenure, responses to these kinds of questions for the record were not delivered in a timely manner. The example I'm going to give you is that on March 22, 2023, he got
Here, we can't really hear. Then, like, in my opinion, they support it.
Gotcha, I understand. So you think as a mob, they should say, hey, that kind of discussion shouldn't occur. In that regard, I agree, right? So,
yeah.
So with that, all you gotta do is make a complaint, and it's against TOS, so then they'll suffer the consequences.
Yeah, well, I mean, I have, and like, apparently from what I've heard, though, it's like people have in talking apes, or like if you make a complaint, like, I've actually reported people who have, like, in talking apes, people who have encouraged, have done things like harassment. Like, there was a guy, the other guy, remember, I made a complaint for harassment in talking apes. His name was Seneca, I believe his name was. But if you don't believe me, Cora was there. She can confirm.
No, it's not that I don't believe you, but these harassment complaints are from one person on the app to another person on the app, and that's just a violation of. It could be a violation of TOS depending on what is uttered or typed inside chat. So it would be up to those that monitor the TOS violations to render the consequence.
Yeah.
Yeah, and also there's just simply not going into the apes anymore. I mean, JCC and I'll speak for myself. I go in the apes a couple of times a week and they attack me all the fucking time. Last thing in the world I'm going to do, well, again, it's just me. I'm not going to report them.
You can go into other rooms and the same thing happens, like Chillism House. They're constantly attacking one another and new people that come in. So now they may have.
I think there's a distinction. I just want to say, like, I understand there's like a distinction. Like, I just think, like, there's obviously a line that be drawn from just simply throwing insults at people and harassment, and even worse, I mean, encouraging suicide. Like, if you do not condemn that in your house, then you support it.
Okay, Necro, was I ever on the top when that happened?
Well, I don't remember you being in those rooms when that happened, so no.
Okay.
Necro, did anything happen recently which caused you to recall this event that admittedly was 2, 3, 4 months ago?
I mean, really, I just have, yesterday, I was really just,
was frustrated with Jeremy because he's a person I've always been considered to be a friend, and the fact
You've got to be kidding me.
yeah.
He's one, and replays are on. Jeremy is one of the biggest hypocritical assholes in the ape. Okay, Jeremy is one of the biggest people that insults and attacks me more than close to anybody else. Again, me, I'm not going to report him. I just press leave quietly. Jeremy's a son of a bitch.
May I speak a little bit, Necro?
Sure.
I'll just give you my opinion. I'm 46, so maybe older than you, and well, it's already, I sound like I'm talking down to you, but I really don't mean to. What I mean to say, when I was in my 20s, I had a really hard time. For a variety of reasons. Most of it's because my house is pretty shitty. I mean, the world is full of a lot of negative people, I think. And at least personally for me, the best thing to do is avoid all the negative people and then find good people. That's just like that's the best thing that I ever did. That's the best thing I ever did in my entire life. Like, I haven't talked to my old man for 10 years because he's a liar. Everybody in my hometown knows that he's a liar. He's a drug addict and alcoholic. And since the time I was probably 6 years old, my job was to try to take care of him and get him out of trouble all the time. But there's nothing I can do to change him. I'm sure everybody has people like this in their lives. You know what I mean? Like, you gotta, I don't know, turn up the good and turn down the bad,
I would agree with that. Like, you can't police all of the world, like, how everything happens. But it's like, I mean, if you have it, like, if my boss is being racist, yeah, I'm not gonna deal with that. I don't think it's good to have those people in your life, but at the very least, you should, take action against someone who is affecting everyone.
Let me also state this. The event that you're talking about, someone in the Apes months ago encouraging you to commit suicide. I've been going to the Apes for 2 or 3 times a week minimum for the past couple of months, and I've never heard it once. Now, that being said, I don't doubt that somebody a couple of months told you that, but I don't want to be one to police free speech. In answer to your title of the room, I do not believe that the Apes should be banned based on what you've described. Now, if they made it a daily occurrence, which clearly they have not, to encourage people to commit suicide, if that's part of their MO, their modus operandi, that's a different story. But just the fact that there are assholes in there, such as Jeremy, who I mentioned before, and there are hypocrites in there, such as Jeremy, the last thing I want to do is attempt to police free speech. Because as soon as I get on my high horse and tell him that he can't or shouldn't be saying those things, then I'm restricting my right to free speech. So this is why, and again, you opened this room, I just saw it in the hallway. This is why I think the talking apes should absolutely not be banned. That's just my humble opinion.
Yeah, and I mean, like I said, though, I understand free speech. I don't think free speech gives you the right to encourage harm of anybody else. I mean, if you encourage somebody to commit suicide and they do the deed, then that is murder.
No, it's not. I have to disagree, man, because at the end of the day, the only person that you have control over is yourself, right? That's what I was trying to get at with my whole dad thing.
Well, Pure, I think there has.
I can't.
Pure, I think there.
Well, let me just land, JCC.
Okay.
What I mean to say is this world's full of assholes, but it's also full of really good people. I see that you do animation and stuff. I actually went to college for graphic design.
This is not related to the topic of someone influencing someone in their life, right? So you're deviating.
I am. Well, let me focus in then. Let me focus.
Okay, try to wrangle it up.
So what I'm saying is there's so many assholes in this world, they're going to give you all sorts of bad advice. Best thing is, like, you know what I mean? Just avoid those fuckers and really go out of your way to look for good people. I mean, that's the best thing I could say, right?
Yes, that's good advice, Pure. But what I was going to say was, supporting what Necro says, people can.
Okay, this is reading Marcus Aurelius on Clubhouse. This is Anon. The reason why I'm doing this room is I have to do a lot of work, and so I'm basically going to stop recording Clubhouse for a while.